Drug abuse and overdose mortality are an ever-present and ever-worsening problem in the United States due to the recent opioid epidemic. In 2020, over 90,000 people died to overdoses in the U.S. This has left the public searching for ways to mitigate the harm caused by drug abuse. One of the proposed and implemented strategies for harm mitigation are safe injection sites. Safe injection sites, or for short SISs, are facilities that provide a supervised and hygienic place for drug use. And the implementation of safe injection sites is a very contentious issue. To explain why, I'll explain the most common or largest arguments for it and against it. It has been shown time and time again that the implementation of safe injection sites leads to not only less overdose deaths, but less overdoses in general. In a study conducted on an SIS in Vancouver, British Columbia, it was found that the fatal overdose in the area surrounding the SIS decreased by 35%, and it only decreased by 9% for the rest of the city. This difference is because of the life-saving training and tools that the staff at SISs have. According to doctors Alex Kral and Peter Davidson, who studied a non-sanctioned site in California, the staff had been trained in overdose prevention, resuscitation using naloxone, and rescue breathing, injecting technique, and harm reduction principles. This means that if someone is overdosing on opioids, that they can be revived. And opioid overdoses make up 75% of all overdoses. And if someone is overdosing on non-opioids, rescued breathing can be administered until medical professionals arrive. Now obviously this isn't as ideal as the first case, but it's far safer than someone overdosing alone or around untrained people who are less likely to contact medical professionals. Besides, people overdosing in SIS is extremely rare, less than 1/10%. In the case that I was just talking about, 2 non-fatal overdoses happened over the course of 2 years and over 2,500 injections. So it's evident that SISs not only save lives but provide one of the safest avenues for drug use. SISs provide clean equipment and hygienic environments which nullify most, if not all, spread of disease. According to the Cohort Vancouver Injection Drug User Study, before the opening of a SIS, 15% of intravenous drug users, which are people who inject, were admitted to hospital for skin infections over 3 years. This dropped down to 9% over the 4 years after the SIS opened. Even though the change wasn't drastic, it was still a decrease. It's important to understand that not everyone has to use SISs, so the 9% that were omitted were likely due to people who didn't use them. Besides, it's still progress. Safe injection sites not only stop the spread of infection for drug users, but they stop the spread for the whole community. Not only this, but safe injection sites cut down drastically on public drug usage, which makes our communities cleaner and safer. In fact, when the users of the unsanctioned site in California were surveyed, 90% said they would have injected in a public place if not for the site. This means that safe injection sites are able to keep dirty needles out of public places and remove what many people think is a nuisance, which is public drug usage. Even though the economical concern of safe injection sites is valid, a lot of taxpayer money already goes to helping addicts in the form of emergency services. In fact, according to the United States Joint Economic Committee, in 2020, $1.3 trillion was spent on the opioid crisis. Not only this, but according to the American healthcare company Premier, opioid overdose costs U.S. hospital over $11 billion a year. So this makes me think, why not spend taxpayer money on something that's not only less expensive, but lowers the number of overdoses and saves lives? It was found in a study of a safe injection site in Calgary, Canada, that $1,600 was saved per overdose, and $2.3 million was saved over the lifetime of the SIS. This goes to show you what I said before. SISs are good for the community as a whole. They benefit everyone. The implementation of safe injection sites is extensively more fair and much better economically than any of the current strategies, which are none, that we do in the US. The far more concerning argument against safe injection sites is that they promote or condone drug use in some way. But to not leave you hanging, this is an unsubstantiated claim. And ultimately, it's important to realize that SISs are neutral. They just provide a place for someone to use drugs and not get hurt or die from it. They don't condone or promote drug use in any way. In fact, many SISs provide resources for people to get treatment for their drug abuse. People still the assumption that an increased access to drugs will lead to more drug usage. However, this is just that, an assumption. To quote the European Monitoring Center for Drugs and Drug Addiction, there is no evidence to suggest that the amount of safer injecting facilities increases drug use or frequency of injections. Also, this assumption completely ignores the reasons behind drug abuse or drug use. People don't just use drugs because they can. People may have problems at work, problems at home, problems at school, or mental health problems, or they may just succumb to social pressure. And once someone is addicted, it becomes increasingly harder for them to just quit cold turkey. But to quote the National Institutes of Health, at first taking drugs is usually your choice, but as you continue, self control can become harder and harder. People with addiction show physical changes in parts of the brain that are very important for judgment, making decisions, and controlling behavior. This issue is similar to abortion in that people will use drugs regardless of whether they can use them safely or not. Stopping the implementation of safe injection sites doesn't stop drug use, it just stops safe drug use. Even though safe injection sites play a huge role in harm mitigation, they ultimately aren't the answer to stopping drug abuse. Now, I don't want to tell you what to do or what to believe. Ultimately, I think the biggest tools at our disposal are empathy and knowledge. Now, I'm sure everyone knows this, and it's pretty silly for me to point out, but people with drug addictions are still people, and they deserve to be treated with the dignity that we treat everyone else with, even if that's just through simple things like not calling them addicts or being more understanding about drug abuse in general. But if you agree with me and you agree with the implementation of safe injection sites, you can always inform your family or your friends to help stop misinformation or disinformation. Ultimately, though, for us to lift up ourselves, we need to lift up those struggling as well, and this includes people with drug addictions. And SISs help make this possible.